6 months ago, the Progressive Impact Organization for Community Development, PRIMORG, after a lot of collaborative efforts, a 28-year-old rape suspect who allegedly defiled and sexually assaulted a 17-year-old girl at Mpape, Abuja, and evaded arrest for months, was arrested by the police and remanded in their custody. Such act of violation is what we come across every now and then. Gender-based violence refers to any act that is perpetrated against the person's will and is based on gender norms and unequal power relationships. According to the United Nations Development Programme, UNDP, gender-based violence is impacting every region of the world. In Nigeria, demography is horrifying, as 1 in 4 girls before the age of 18 experiences violent sexual encounter, while 1 in 10 boys is being abused daily. Nigeria's Minister for Women Affairs, Iman Sulaiman Ibrahim, in commemorating the 2024 16 Days of Activism Against Gender-Based Violence, disclosed that 30% of Nigerian women and girls aged between 15 and 49 have experienced physical or sexual violence at some point in their lives.
Sexual and gender-based violence is a menace in our society, and is something that has to do with violation of the rights of the survivors. It has to do with infliction of injuries on the survivors, and it also has to do with mental health issues.
Sexual and gender-based violence it still remains a serious public health issue because more and more cases are being reported, even as much as many more are unreported. Now, the implication for a society like ours that is enmeshed in the rising cases of sexual and gender-based violence is that in some cases it leads to death of the victims. In other cases, it leads to trauma for survivors. And when they suffer trauma, there is high level of psychological and emotional imbalance. There's depression, which of course robs the individual who is a victim or a survivor of composure and the mentality to be able to even pursue a living or even contribute meaningfully to society.
PRIMORG's approach towards sexual and gender-based violence is multi-layered. We have been sensitizing students and the general public through our outreaches, radio programs, and social media. Over time, PRIMORG identified poor support for survivors of sexual and gender-based violence as a major problem. Hence, we decided to popularize centers where citizens can get help free of charge in the Federal Capital Territory, FCT. Inside the Buhari General Hospital is located the Auyetu Sexual Assault Referral Center.
This center, which is a sexual assault referral center, is a place that has been set up. It's one out of about 47 of them all over Nigeria, special centers that are specially designed to provide comprehensive care for survivors, or you want to say victims, but we want to call them survivors of sexual and gender-based violence. So what we do here is a place where we provide comprehensive and integrated services to survivors of sexual and gender-based violence. And from our statistics, we discovered that over 90% are females. But out of those 90%, 90% of them, the females, are aged under 18 years old. But we have people that are also above 18 years old. But the services are free, in the sense that when you are asking people to come to a place of succor, you don't charge them. So the registration is free. The doctors attending to them are already on the payroll of the government and the counselors and the nurses. So they are not paying for any stuff. Even the drugs and the lab investigations, they are all provided free of charge.
Our next stop was at the Sheshe Yara Child Advocacy Center, located at First Avenue D2, Salatu Royal Estate, Wuse2, Abuja.
So our work covers psychosocial support, medical examination, legal services, forensic interview. We also have shelter services because some of these children or survivors that have been sexually abused before, they may not have a place to stay, or they may need to be taken out of that environment. So we provide shelter services for them to ensure that they recover quickly and also get them to receive psychosocial support aside from getting legal justice. We believe that they are part of the vulnerable groups, and 90% of cases of sexual abuse that we have more children, and most of them don't have that free space or understanding of what is really happening to them. So that's why we focus on children advocacy. That's within the age of 0 to 18 years old. However, we have cases of adults who were abused as children, and people respond to this thing in different ways, or some people just get to know about the services that we offer or access to care when they're already 20 something and all. So when they come, we don't also send them, we try to offer the support that we can offer to help them to become whole again and better in the society. So our services are free.
Experts and activists say continuous sensitization is needed to confront sexual and gender-based violence, while prompt punishment of culprits remains a veritable tool to discourage the evil act.
So we want to encourage anybody that's passing through sexual and gender-based violence in any form that I've explained, whether a boy, whether a girl, a man or woman. Please, it's time to speak out. It's time to, let people know that this offense is a crime. Apart from the fact that it's a human rights violation, it's an assault to the person, is a criminal offense, and the sentence is life imprisonment. It's as serious as that.
We need more strong, abiding laws against this crime. When you talk to survivors, you hear them say things like, I want justice, I want the person to be punished. Now, doing one thing that the survivor wants actually gives them a sense of healing, a sense of consent from other people, a sense of them not being alone. So yes, getting most of the perpetrators to book will give survivors a feeling of yes, that they are being supported and they are being heard and justice is being served for them.
We really appreciate this, and we're really excited to get to know that PRIMORG is here and they want to publicize, amplify what we do. So we believe that the more people get to know, like I mentioned earlier, the importance of sensitization, the importance of advocacy, the importance of publicity cannot be overemphasized. There are people that walk in here and will just say, oh, thank God, if I didn't know you guys existed, oh, thank you so much, thank you, I didn't know that I could get this service for free, oh, I've been abused for so long, I just kept quiet and all that. So we believe that this collaboration and this partnership, I'm sure that with the platform and also the platform that PRIMORG has, it would also help us reach another set of people or a larger audience to get to know more about what we do. So I believe that this would really help our society. It will help people to speak up, knowing that there is somewhere they can go to and they can get access to care, they can get access to justice, they can get information, because prevention, they say, is better than cure.
There is a yawning gap between the empty rhetorics of government and concrete action. Government just waits for 16 days of activism and make statements about so many things. You would recall that successive attorney generals of the Federation have actually talked about a special court for sexual and gender-based violence. They've repeatedly said it since our renaissance democracy. Every attorney general waits on 16 days of activism and makes the pronouncement. But there's nothing like that. The major step that can be taken to curb sexual and gender-based violence is bringing people to book. You can only curtail, you can only reduce sexual and gender-based violence. To end it, in all honesty, No. And who are those who can help to curtail it and reduce it? Of course, PRIMORG, with the wonderful work it is doing with its partners, okay? Creating a platform where we can continually discuss this matter and speak to people and affect them positively, using the platform of PRIMORG and what organizations like Men Against Rape Foundation are doing to cause behavior change, using behavior change strategies to communicate with society, with community, with male folks especially, recruiting them into advocacy, making them champions who become role models, speaking again against sexual and gender-based violence.
There are 47 sexual assault referral centers in Nigeria across 22 states, including the FCT, that provides free medical, counseling and support services to survivors of sexual violence. The number is abysmally low for a country estimated to have over 220 million population. The government and its partners must address this problem immediately.
For us at PRIMORG, we are anxious for safe spaces for Nigerian women and girls. And survivors need to know that they can heal and also get justice. We will go beyond the 16 days of activism against sexual and gender-based violence, as our approach is an all-year-round sensitization of citizens in collaboration with organizations like ours. We will not relent in raising concerns with the appropriate authorities for prompt action.